Hi, I'm Dr. Isaac Alexis from the Slim Samurai Group 84, helping you to slash through sickness and offering you a slice of health and wellness. Today's topic is opioid epidemic, methadone dosing, what they're not telling us. Once more, the opioid epidemic, methadone dosing, what they're not telling us. Before I continue, don't forget, Slim Samurai family, to smash the subscribe button, like, comment, send a 25 to your friends. Comment so I know what to speak on for the next topic medically. Now, as I mentioned before in my prior video, some 500,000 or 500,000 people died from opioid overdose over a 20-year period spanning from 1999 to 2019. Now, there are 3 modalities for opioid use disorders in terms of treatment modalities that I've reviewed in my prior videos. But today, we're going to talk about methadone, specifically methadone dosing. Now, it's a taboo in many circles, and sad to say, even in the medical community, methadone is a taboo, and it shouldn't be, with some 140 people dying daily from opioid overdoses. Now, we're going to look at initial dosing, we're going to look at maintenance dosing, and what they're not telling us in the midst of methadone dosing. We'll dig into that much deeper later on in the video. Now, initial dosing of methadone usually is from 20 to 30 milligrams single dose, provided, listen very carefully, that there are no signs of sedation, intoxication, and when the patient shows the maximum symptoms of withdrawal as indicative on the clinical opioid withdrawal scale, COWS for short. Maximum initial dosage being 30 milligrams. Now, pay close attention to this. Lower doses anywhere from 2.5 milligrams to 10 milligrams. I'll repeat it again. It's very important to listen. Anywhere from 2.5 to 10 milligrams, and much slower titration should be considered in patients with no or little to no tolerance at initiation, meaning absence of opioids for 5 or more days. They generally don't take opioids daily, or in the past, using weaker opioids like, for instance, codeine. Now, with any initiation of methadone, you must observe patients for oversedation and withdrawal symptoms for 2 to 4 hours after initial dose of methadone, based on the American Society of Addiction Medicine 2020 guidelines. Now, an additional 5 to 10 milligrams may be provided if withdrawal symptoms have not been suppressed or if symptoms reappear anywhere from 2 to 4 hours. Now let's talk about maintenance. Titrate dose so no opioid withdrawals occur for 24 hours. You can't just look at 12 hours. It's got to be at least 24 hours. The expert consensus is to increase no more than 10 milligrams methadone every 5 days, based on the American Society of Addiction Medicine 2020 guidelines. The usual range for your maintenance dose is 60 milligrams all the way up to 120 milligrams. Now, let's look at the next issue. When switching therapies, there's a lot of confusion. Patients ask me this all the time, and they say no one is telling them this when it relates to methadone, and they want to switch to Suboxone, buprenorphine, naltrexone. Let's look at when switching from methadone to buprenorphine. What you want to do is taper the methadone gradually down to 30 to 40 milligrams, and you want to remain on that dose for at least 7 days. Don't just stay on that for 3 days and think you can jump to Suboxone. No, at least 7 days, if not 10 days. Now, patients must be in mild withdrawal before starting any type of buprenorphine. You may ask why, and this will be after 24 to 48 hours after the last dose of methadone. Now, very important, initiating buprenorphine at lower doses, for instance, 2 milligrams, will decrease the risk of precipitating a methadone withdrawal. Why? Because that buprenorphine is a beast when it comes to displacing that mu opioid receptor. It wants that receptor all for itself. And it's not a shame to kick out any other opioid agonists on the opioid mu receptor. Very, very, very important. As I said, these are pearls, golden nuggets that no one's talking about with the methadone dosing. When you're coming to switching to alternative medical treatments, when a patient is feeling very motivated and doesn't have such intense cravings, doesn't want methadone, now wants to be placed on buprenorphine, whether it's Suboxone, whether it's Subutex, or what have you. Now, there are some patients feeling extremely motivated and wanting to do switch therapy all the way down from methadone to naltrexone. They may not like the taste of buprenorphine strips under the tongue. It tastes bitter. Some have complained of just upset stomach with diarrhea. Some have complained of just massive sweats, and they just don't like it. So they say, Dr. Alexis, I just want to go to naltrexone. What do I do next? I'm glad you asked. What you want to do in all cases of opioids, whether it's buprenorphine, whether it's methadone, morphine, you want to taper the methadone dose down gradually to the point of discontinuation. Now, you must wait once discontinued 7 to 14 days before initiating naltrexone. The indiscriminate initiation of naltrexone right after methadone can precipitate violent withdrawals in severe cases, leading to heart attack, strokes, coma, even death. So this must be done in a supervised fashion by a medical professional. So that is the critical regimen that no one is discussing when it comes to methadone dosing, titration, and the methadone switch therapy to other medications. In some settings, some drug courts may say you can't be on any opioid. We only will let you be on naltrexone. Or in order to get custody of your children, in some counties, they specifically want you to be on only naltrexone. It's based on your jurisdiction, county. Nothing ever is written in stone, of course. But these are some general guidelines that's going to shed more light on what to do if on methadone or other opioids, and looking to be either on maintenance or methadone switching therapy. Don't forget to subscribe, like, send to 25 people, comment so I know what you, my Slim Samurai and Samurettes, want me to discuss for future videos. I'm Dr. Isaac Alexis from the Slim Samurai Group 84, helping you to slash through sickness and offering you a slice of health and wellness. God bless.